Joining us today. We are going to get started. Welcome to the second panel hosted by Care+Wear, a symptom of the pandemic, accelerating patient-focused care and healthcare consumerism. Today, we are going to focus on solutions to help better serve patients, improving healthcare delivery and transparency, as well as strategies to empower patients to navigate their healthcare experiences. My name is Razdan, and I'm the founder and CEO of Care+Wear and moderator of today's discussion. I started Care+Wear in 2014 with the mission to bridge fashion and function to create a more human healthcare experience. In creating each of our products, which includes hospital gowns, NICU onesies, PICC line covers, chestboard access tops, post-reconstructive surgery bras, and most recently, scrubs, we've been able to work with an incredible network of doctors, nurses, clinicians, designers, manufacturers, and more to make sure that every product is medically superior, functional, and comfortable, and that we are helping to advance the field of healthcare and improve patient outcomes. The goal of these webinar conversations is to bring together leaders in the healthcare space to discuss various topics that will help reimagine the future of healthcare. So today, we want to explore what healthcare consumerism is and how that has changed patient-focused care, enhancing the patient experience. So without further ado, I'm honored to introduce our esteemed panelists. Nicole is the Senior Director, Patient and Consumer Experience and Patient and Family-Centered Care at North Shore University Hospital in Manhasset, New York at Northwell Health. In her role, Nicole oversees the optimization of the healthcare experience for patients, families, and teams through physio-social support. She is responsible for setting a strategic vision, synthesizing the patient perspective, and feedback to improve the experiences of the communities North Shore University Hospital serves. Understanding the intricacies of fostering a healthy work environment and the impact it has on the community's experience, Nicole addresses the interpersonal aspects of care through experience design, holistic caregiver recognition, and volunteer programming. She Schwartz rounds and Team Lavender. She holds a BA in psychology from Hofstra University and earned an MS in mental health counseling from CUNY Queens College, New York. Next, Dr. Diane Reedy is the Associate Deputy Physician of the Regional Care Network and President of Medical Staff at Memorial Sloan Kettering Cancer Center in New York City. Dr. Reedy is also a physician liaison for the Patient and Family Advisory Council on Quality. During the COVID crisis in New York City, she served as Chief of Clinical Care in the COVID setting as part of the Hospital Incident Command System. A noted clinical investigator, Dr. Reedy served previously as Associate Deputy Physician-in-Chief for Clinical Operations, Clinical Director for the GI Oncology Service, and Co-Director for the Medical Oncology Hematology Fellowship Program. As a researcher, she focuses on developing methods to integrate molecular-based therapies into the treatment of neuroendocrine and endocrine tumors. Diane maintains a high-volume GI oncology clinic as well. And last but not least, Jody Reyes is the Interim Chief Operating Officer at UVA Health in Charlottesville, Virginia. Jody has extensive experience in professional nursing and clinical operations. She had a progressive career in academic medical centers and as a Nurse Corps officer in the U.S. Navy. As Interim Chief Operating Officer, she has oversight of the medical center's patient population service lines, directly responsible for the effective management of operations across the care continuum. She provides day-to-day guidance to service line leaders, promoting the advancement of quality service and a culture of excellence. She also holds an appointment at UVA's School of Nursing as a clinical instructor. Prior to joining UVA in 2012, she was a member of the executive nursing team at the City of Hope National Medical Center and UC San Diego Health. We are so honored to have you join us, and thank you all for taking the time to be here today. So why don't we dive right in? In the midst of the pandemic, Healthcare overwhelmingly pivoted the focus on ensuring everyone who needed care was able to receive it. Many are returning to receive preventative care, seeking well visits, dentistry, and more. As both providers and patients are working to navigate this transition, new solutions and delivery methods have been emerging. What does it mean to transition back to a market of individuals that are looking for more tailored care and support from their healthcare institutions? Dr. Reedy, could you please kick us off?
Great. Thank you so much for inviting me today. It's really an honor to be with you all. I think that there were so many crises during this terrible time for all of us around the world, but there were some silver linings as it related to healthcare. I think that we all quickly iterated to telehealth platforms and other opportunities that allowed our patients to stay in the comfort of their own home while it was safe during the pandemic. And certainly in our world of cancer care, where I am at a cancer hospital, we are seeing more and more still of our patients virtually. And so for patient convenience and importantly for financial toxicity issues, our hospital is in New York City. And so it's very inconvenient and quite frankly, costly sometimes for our patients to have that. So we've been able to sort of iterate and keep that going with the advent of telehealth, which we'll probably talk about a lot more later, but to acknowledge that the support that our patients really need. So I think there have been a lot of lessons learned during the pandemic, but one of them is how we can iterate to really maintain our patient focus and the patient experience, but in ways that allow us in some ways to go to the patient as opposed to the patient always coming to us.
Great. Jody, how about you?
Thank you. Yeah, to Dr. Reedy's point, this was such a complicated time. So much fear, so much unknown. And while our volumes are back to where they were pre-pandemic, in fact, busier than they seemed to ever be prior to the pandemic entering all of our hospitals and all of our homes and our lives. One of the things that we learned very quickly is that our patients, their families, they want to know that when they enter our facility, they're going to be safe. And so it was really important, as Dr. Reedy mentioned, about telehealth. And it's interesting because we had telehealth available to us for 5 to 10 years as a technology, but we are a little slow to move in healthcare. We're a little slow to adopt. And that model of the patient coming to us in our doctor's office or into our hospital has just always been the way that we've done it. And so I was very proud of us in our industry for being able to pivot quickly. And so I guess the key here will be if we're able to sustain it. But I do think that as we have ramped back up to see patients that are non-COVID, we have been challenged because of the different waves that we've experienced. And so for the moment that we are at a place where our COVID volume is actually very manageable, thank gosh, for all of us that we're in that place. But as we learned with the Delta variant, we could end up with a full hospital once again. And how do we continue to keep our doors open to those to feel safe and yet be able to take care of all the patients with their unique needs?
I couldn't agree more and certainly echo Jody and Dr. Reddy's sentiments. The pandemic has certainly turbocharged our efforts to be consumer-centric because as a silver lining, I think we were flexible and some of that red tape was removed, whether that was with regulatory concerns. We found the yes. And at Northwell and North Shore University Hospital, we had always been really good at trying to find the yes, but this certainly tested us. We were challenged really to put our patients in environments we never imagined would be possible. And I would also say that over the past 2 decades, and certainly since the start of the pandemic, the site of care has been shifting for us from inpatient to the outpatient setting. This was definitely another turbocharging opportunity for us, where we really started to think very thoughtfully about where our patients were most safe, how they could trust us most, and what made the most sense to be able to deliver care for patients who were sick with COVID, and then our patients who were also sick and needed a different type of care.
I would also just emphasize, like Nicole and Jody said, one of the things that was truly remarkable during the COVID crisis, particularly in the New York area for us, like Nicole's hospital and my hospital, we were constantly on the phone all the time to define the safest protocols that we could all think of, because obviously New York got hit first. And so it was really a very quick collaboration to figure out very quickly how to keep our patients safe within our walls. And that continues today. So like you said, Jody, like we are so focused on keeping our patients safe, both on the inpatient and the outpatient. And so those protocols have kept COVID literally out of the, the walls of the hospital, except for obviously the patients that are being cared for with COVID. So I think we've learned so much about the disease and what it can do, but we've also thankfully, developed these very appropriate protocols to keep our patients safe.
Yeah, I've been very impressed not only on the safety element. I had family members that had to go into the hospital during the pandemic, and the level of safety and security that you felt in a really terrifying time was really impressive, but also the collaboration between hospitals. Dr. Reddy, kind of like what you said, right? Like your hospital and Nicole's hospital were both talking to each other and interacting, and in other industries that would never happen, right? Because they are technically direct competitors. And I think that that's pretty incredible. I just finished reading The Code Breaker, and in that they talk about all the collaboration that happened to help fight COVID from the research and science side as well. We're gonna direct our next question to Jody, but Nicole and Dr. Reddy, please feel free to jump in as well. Today, patients are becoming more and more involved in their own healthcare decisions, from deciding on which treatments they'd like to conducting research before checking into a facility. How is this evolution of patients selecting their healthcare services and systems encourage hospitals to deliver information that is easily digestible?
It's a great question. And I'd love to say that we've cracked the code on exactly what it is that our patients and our families want and need from us. Yes, absolutely. Our patients and families are showing up more educated and knowledgeable about the process, about the system, about their expectations. What I will say, though, is that the information that we have at our fingertips is not as readily available in our big academic medical center as I'd like to think that it could be, and quite frankly, that our patients expect of us. We are very complicated in terms of the way that all of our information comes together. And so how do you synthesize that in a very timely and organized way to educate our patients and other consumers about what it is that we can offer? And I can give an example of that. Whereas, Medicare has for years now been talking about price transparency, and that we need to put on the internet out there for the world to see our pricing of our different procedures. That sounds like an incredible opportunity. It is far harder to do than it would seem. And there's lots of reasons for that, but how do you communicate to the consumer about the things that we want them to know and the things that they need to know, and the things that they want to hear from us? How do you do that in a way that's digestible, timely, and in a format that they can actually receive?
Definitely. And it's one thing that I think will continue to evolve for sure over the upcoming years. So our next question is for everyone. Care+Wear recently did our own study of more than 2,100 individuals, talking about how they felt about a return to hospitals after the last year of the pandemic. The data overwhelmingly states that nearly half of patients and clinicians going into a hospital have said they feel scared or nervous. More than half of the patients reported that frequent communication from doctors and nurses made them feel more safe. How are you working to make sure, and I know we talked about this a little, but how are you working to make sure patients not only feel safe, but also that patients continue to choose you and your healthcare system for their healthcare needs? And we're also, just so everyone knows, while everyone's answering this, we're going to push out a question we asked via poll as well. Nicole, do you want to start with this one?
Sure, I'd be happy to. So I'm going to build upon the theme of trust and safety. I think that aside from physical safety, our safety in terms of emotional health and psychological safety is extremely important to our consumer. So our clinical team has done an absolutely incredible job in keeping our patients physically safe and helping to get them back home. We in the experience world have really focused on safe visitation and effective communication, because really at the end of the day, what is most important to our patients and families is that they feel while they're with us that they can trust us. And part of that is understanding their plan of care. And with the pandemic, yes, we leveraged technology and we were innovative and we felt differently. But when our loved ones when our patients couldn't have their loved ones here, they were really robbed of that opportunity. And we are just really thinking outside of the box. We have a culture of care at Northwell Health, and that really means just being empathetic and being aware, being respectful and kind, and leveraging the technology. I think has definitely been something in terms of access and thinking just outside the box. So I'll stop there. I could go on for a while, but I'll hand it over.
I love it. I love all the great initiatives you have underway already. Dr. Reedy, how about you?
Yeah, I think just to echo the safety protocols that we've learned and iterated are pretty sound now. And so, before the pandemic, we didn't have an easy way to even email our patients, which sounds so silly and ridiculous, but like in a way that was HIPAA compliant, and just trying to figure all that out was just kind of, we learned so much. Building the plane in the air was our kind of laughing, sort of terrible, but real joke around here. But I think that we were constantly now emailing our patients to provide updates on those protocols. We sent out videos in English and Spanish and in Russian to let people know what those protocols were and how safe they were. But I think to Nicole's point, like one of the most devastating parts of it all is particularly on the inpatient setting, when we're trying to keep our patients so safe and not allowing family members to come in, with exceptions. So end of life patients and other things are certainly in opportunities where, patients really need to have their patients at the bedside. But overall, that was a part that was very hard for all of us, because obviously we're taking care of the whole patient. And we often say, in the world of cancer, it's a family disease. So it often, not only affects the patient, but their family members and the caregivers and other things. So that continues to be a struggle. Actually, New York State in particular had guidelines and laws. So it wasn't even like a patient choice. It was rather, we were following the governor's mandate. So there were, we were sort of, even in the most protected situation, you just couldn't do certain things that you may have thought was sort of unfair for a patient or their family members, et cetera. So I think, though, importantly, we tried to communicate and be honest and transparent about why we were doing what we were doing, and, constantly trying to take advantage of technology, and, sadly had patients in the car on video, things that we needed to do to keep patients safe, but making sure that everybody knew plans, and that we were, associating all the people that, the key stakeholders that needed to be involved were involved.
I love that. And Jody, how about you?
I would love to just build on the prior comments. I would like to take it though from the direction of our team members and our staff. Nicole and Diane have talked about communication and education to our patients and their family members. But what I think that we learned is that just as scared and fearful and frustrated and angry as some of our patients were feeling, our team members were feeling the same way. And what we found is that we could not communicate enough with our team members, especially those at the bedside, about what were we doing in hospital leadership to ensure their safety. What were we doing to ensure the safety from one patient to another, from a non-COVID patient to a COVID patient? Our caregivers deeply cared about these issues. And so some of the things that fall under my scope of oversight at UVA Health is the lab and the pharmacy and employee health. And so what were we doing to make sure that we were testing our team members appropriately, that we were getting them vaccinated, that we were giving them the proper guidelines around traveling when they wanted to go visit family for the holidays? How did we ensure that we were keeping our team members safe so then we could be here to take care of our patients?
If I can just add one more thing, I totally agree with you. And I really think we saw such an outpour of generosity and support from our community. And that was the way that, our community members felt that they could help in a time of, such unrest and unease, and keeping those relationships with our community members that were so generous to build upon and have, there's such bi-directional benefit to really instilling relationships way before they ever come to our campus, so that they truly understand our mission, our purpose, has been another silver lining for sure.
Yeah, I know here in New York, one of my favorite parts was the 7 p.m. cheer that we started doing every day. And I remember the first day it happened, I was like, what in the heck is going on? And then getting to be a part of it and getting to celebrate the work. And coming from a family with a clinician, and I guess my mom tells me it's still not too late for me to become a clinician, but coming from a family with clinicians, just appreciating everyone for all the work that you all do and all the work that all your team members do each and every day, I think is incredible. And that's one of the beneficial outcomes of the pandemic, I think, is most people, I don't want to say all and speak for everyone, but at least in my opinion, most people have started to appreciate that more. I was at brunch this past weekend with friends that had babies during the pandemic and talking about how they were able to institute telehealth into their post checkups and being able to leverage it both for the safety of the doctor, but also for the patient, and allowing both to maintain that relationship in a more safe manner, I think was really great. And speaking of that, one thing that's interesting, the emotion most logged most frequently in the poll we did just now was nervousness. So most people are demonstrating that nervousness. I'm sure that's not a surprise to any of you. Nicole, we'll direct our next question to you. Increasingly, we're seeing places like One Medical, Tend, and more like that look and feel like hospitality rather than a healthcare center. I know my personal One Medical doctor just texts me all the time through the app. How far off are we seeing hoteliers and healthcare systems team up to give patients the Ritz-Carlton experience they're looking for?
Yeah, so I think Dr. Reddy said it best. We were at a place pre-pandemic where it was pretty challenging from a HIPAA compliance standpoint to communicate with our patients, and communication and that trust is the foundation in healthcare, right? And that's a little bit unique to the hotel experience. Of course, you want to trust you're in a safe place when you're traveling, but the communication, I think, bar none in this environment is something that is a main focus to our consumer. So what I will say is we're certainly making strides. I think we have to be thinking in a personalized way, how do we deliver a sophisticated experience? But in full transparency, I think we are, for large academic medical centers, we're a bit away. We are making steps. I will say, I think we really have to challenge the traditional healthcare model at its core, meaning peeling back all of those layers and starting with how we really deliver that care and the culture that we have in healthcare, right? And we've seen shifts throughout the decades where we're trying to really be patient and family centered at this time, but it's the consistency that we need to get to for us to be anywhere near close to being able to deliver a model that we could build upon having a hotel-like experience. There's just many intricate dynamics that come into play when you come into a hospital. Yes, I can say that from a food and dining perspective, are we making incredible strides? Yes. And does that help in terms of healing when you have very nutritious food that's culturally appropriate? Yes. I could talk about our first impression in our lobby and are we making strides there in terms of leveraging technology? Yes. But at the root of all of this, I think it really comes down to challenging what we've known to be how we deliver healthcare. And that's going to take a bit more time.
No, absolutely. And I think all three of your hospitals, having gone into all three of them, I think that first encounter with the person at the greeter, if you will, is always a positive one, and one that's great, but totally understand. And speaking about communication and talking about how places like One Medical and 10, the clinicians and staff are communicating with you constantly. And kind of, as Nicole, as you said, that's one area that kind of the larger health systems are still working on a consistency basis. From our survey, one of the top results for how to make patients and their families feel more comfortable was through more thorough transparency and communication. Jody, as the healthcare system increasingly transitions to a more healthcare consumerism model, how are you dealing with the notion that in order to deliver medical care in a way patients are eager for, you may actually need to be providing hospitality services?
I think that the more that we can do to normalize the clinical experience for patients, whether that's in the ambulatory setting, having a procedure, or on the inpatient side, the more that we can make them feel like they are in a non-clinical or a more home environment, the better off we are all going to be. We know there has been research done that shows that the aesthetics that are around our patients, like the right kind of art on the wall, the right kind of lighting, having natural elements in your clinical spaces, those things matter. And I will just say, they're not inexpensive, right? To do that work and to make, to transform your clinical environments to make them more non-clinical feeling can be very disruptive. It can be disruptive to our patients to actually take on that work because it usually is going to happen during a clinic, or it's going to happen on it while you're trying to sleep after having had a procedure. I do think that we still, though, have to be innovative in our thinking and think differently about how do we do that better. One way, of course, to do that is leveraging our patient and our caregiver advisory councils, which I think all three of our organizations have those. and being able to ask, are we on the right track? What do we need to do different? What do we need to do better? And really letting them be part of the decision-making and the guidance for us to get it right.
Yeah, I love that. Well, before we jump into our Q&A, I have one last question that I'd love to hear from each of you. And that is, where do you see the healthcare consumerism trend going next? And by the way, the correct answer is obviously utilizing Care+Wear products throughout the hospital, but we can ignore that one because that one's the obvious answer. But besides that, where do we see it going next and how far can it go?
I could start. I mean, I think that the last question was important because, you know, hospitality is obviously broadly defined. I think for us, one of the biggest challenges is the team care we're providing at any one time, right? So even as a very specialized cancer hospital, one patient may have 5 or 6 docs taking care of them at different times for different reasons. And so how do we coordinate that care? And can we empower the patient to have their own data and use that to be able to help us quarterback their own care, which, you know, we always, as docs and clinicians, we're sort of used to overseeing everything, but in today's complicated world and potentially different places, and not all the EMRs are all connected, et cetera, it gets increasingly more complicated to do that. And that gets trickier. And quite frankly, from a safety perspective, from our own patients, can be challenging and a little bit worrisome. Like if there's things going on that I might not necessarily know because the cardiologist is local in New Jersey when I'm in Manhattan, you know, that kind of thing. So I envision consumerism where hopefully the technology allows for the patients on their phone or wherever there might be to have that information and data and allow them wherever they may be to share that in an appropriate way, not just their own medications, but other things, and being able to communicate in a way that allows us to do so.
Yeah, I totally agree. And I think that we are going to be in a situation where we have to adapt. Like an airline, you can book your travel through an app, and why can't we do that for, you know, our procedures or our appointments on a consistent basis? Yes, we're doing pilots and we're doing, you know, different service line initiatives or programs, but from a holistic perspective, that this just be the norm for all 3 of our institutions.
I agree. I think that it is it cannot be overstated how complicated the world of healthcare has gotten. And I think if there are any consumers on this panel, listening to this panel or going to listen to it later, I hope you just understand that hospitals are full of leaders, team members that want to get this right. It's why we do what we do. And we realize that we fail to meet expectations every day. And in some ways, that's a good thing because it keeps us coming back, wanting to do better, wanting to learn more, wanting to really meet your expectations. We've got a lot of systems that we interface with that just are antiquated. And here we have this cutting edge physician care, this clinical care that is better than you can find anywhere in the world. And yet in my hospital specifically, we just figured out how to send text messages over the last year to our patients, reminding them of their appointments, right? My veterinarian, my dentist has been doing that for a decade. And it's not because we're incapable of learning or we're not smart enough to understand. It literally is many competing priorities. Do we have the right systems in the place? Do we own the right technology? Do we even have a way to get people's cell phone numbers accurately, right? It's so complicated, but please just know that we as leaders in this healthcare industry want more than nothing more than to get this right for our patients, for our families, for our team members.
I love that. And I think the positive of that is if you think about baseball, for example, we celebrate people that are successful 30% of the time. If you have a 300 batting average, you're an all-star. And so all of you are still all-stars in my mind, even if you're only hitting it at a 50% rate, I guess, if you will. So I guess now that we are in our open Q&A, the first question we've gotten is, as are hospitals rethinking the way that they build, the way that they train clinicians, and the way that they market themselves to appeal more to patients?
I'd be happy to take this one,
Yeah.
kick it off. Absolutely. And I think it goes to what I was just saying about how this is the work of ours that we want to excel at. You know, it used to be that our disciplines were trained very independently and in parallel, and you expected them to come together and kind of figure it out at the bedside. In the future, it is a mandate that we train our teams as teams, and we look for the strengths of those different disciplines and how they can synergistically play off of one another in order to really drive the best patient care and the best experience. And so that's not easy to do. You know, again, you think healthcare is complicated. Well, think about academia, right? And their legacies and how they educate. So it's really multifactorial of how we have to come at this. But even if it's how you're building a brand new unit, so let's say I have a new hospital or I have a new floor and I get to build a new unit. How do I set up the computers? Do I even need a nursing station anymore? Where do you put all of this so you have people who can communicate together? I think that that's really our challenge.
I can certainly just build upon that. I would say we're very much of the mindset of promoting shared governance. And what does that truly mean? We have our Central Collaborative Care Council that is comprised of our interdisciplinary team members that are meeting on a monthly basis. And we've really worked hard for it to be our providers and our nursing staff with our support services team so that everyone has a seat at the table. And that really then translates to what are the expectations of our consumers and making sure that it is a personalized experience, not only for our team members, but then that's for our patients and families, that we always are on stage, that we feel empowered, that it's a frictionless, healthy work environment, that we are simplifying and reducing barriers, and then that we're transparent and empathetic.
I agree with all of those. The other thing that we've done, particularly in the last year, and we certainly have ways to go, is to try as best as we can to build our faculty to be more diverse and to try to engage other patient populations. So, you know, I think we really have ways to go, as I said, but we have really tried to recruit and retain faculty that will allow other patients to feel safe. So patients of color, et cetera. So it's something really that we recognize is so important to get to where we need to be, certainly in the cancer world, but anywhere in healthcare. So that's something that we've really tried to emphasize, and for trainees, also obviously recruiting in that way. But the other thing we've done differently with our own trainees is to realize that our patients, you know, are not necessarily, again, coming to us, that we need to go to them. So focusing on our regional care network sites, which are more in the suburban sort of areas, and making sure that our trainees know what that's like too, because it's a little bit different from focusing, you know, at the mothership where different things are happening in different ways. So I think we're all trying to sort of pivot a little bit and sort of recognize all these different important aspects of the patient care. And it's obviously taking care of the whole patient, not just on the disease that you're specialized at.
That's a really fantastic point, and kind of taking that point even further and thinking about patients and financial disparity. Obviously, you know, we're talking about healthcare consumerism and that impact, but the ability for someone to self-select into a hospital system assumes an incredible amount of privilege. how does the trend of healthcare consumerism impact those who don't have the financial means to choose the hospitals they attend? Are there winners and losers in this? And in your mind, is healthcare consumerism and the fight to provide healthcare for all actually at odds with one another? Dr. Reedy, why don't you start this time around?
That's a really good question. Really good. So I think that the short answer is we are trying. I think that the reality is when push comes to shove, as I talked about, we talked about training more faculty and more trainees so that we have more physicians of color and of diversity. But often that means, different insurance providers. And that part gets a little bit tricky for us as a cancer hospital, in part because some insurance just quote won't take us. But what we have sort of committed is, at the very least, any patient that wants to come to MSK, we will figure it out to at least give some sort of advice and then work closely with those docs. It's still not perfect, but I think that that piece is very important on how do we allow the important care that we could potentially deliver to all of our patients across the board. So we're taking small steps. We are going into communities that wouldn't necessarily come to us, and really trying to emphasize, that importance and seeing who they are and making sure that, we are seeing those patients. So we still have ways to go. But I think that it's certainly on the radar, and certainly something that everybody is really working towards. And quite frankly, Medicare and other places are saying that you have to have certain percentages in order to get those Medicare dollars in the future. So it's something that we all not only need to do because it's the right thing to do, but it actually will be potentially important for reimbursement issues. So I think there's a lot more to come on that piece.
Totally.
Yeah, the last thing I just wanted to say is actually US News and World Report have also said that they're going to use diversity as a metric on, top hospitals moving forward, which would be really interesting. How they define that and what that looks like is going to be, yet to happen, but I just think it's a good thing.
Oh, that's awesome. I guess taking a step back, when we think about the past 2 years, and I know all three of you have mentioned initiatives that were kind of put on hold while you were scrambling to try and, I don't even want to say solve COVID, but try and protect people. How did COVID change not only the focus on patient experience, but on all quality improvement initiatives? Has it sped it up? Has it slowed it down? What kind of impact have you seen at your institutions?
I could start. I think Jody started off by saying what is so true. Healthcare is so slow for everything, like science is slower than we want, but actually when science works in like the COVID vaccine, when it works well, boy, can it just, quickly jump to fifth gear, which was nothing short of remarkable. But that is what happened also in COVID. So, overnight it felt like, but certainly over like a week, the number of telehealth visits we had, and as Jody said, we had the platform, it just wasn't being used. It went up by 2,000% because all of a sudden it was like, okay, I have nowhere to see this patient, get them on, and at first we didn't use it and we used FaceTime, and then we quickly moved over to Doximity, but then we had all these different platforms that were actually being used. And now almost everybody has their own version of some platform that they found to be successful. So there's no question that it sped things up for sure. And it allowed us to, obviously recognizing some of the challenges of not letting patients and family members necessarily see each other, et cetera. But overall, I think the progress on the way we deliver care has absolutely changed during COVID in a more positive way.
I'd be happy to go next.
Go for it.
Save the best for last. Nicole, you can chime in here. What I would say is it's changed everything. There's really nothing pre-pandemic that I think about how we engage in our work that is the same as it was 18 months ago. And it's interesting because one of the most common questions that I used to be asked while people were still working mostly remotely from home, when the rest of the world was, and I would be asked the question, well, how many days did you stay home? I came into work every single day. And I'm not saying that because as if that I deserve a pat on the back. I'm just simply saying that in my role, every single day there were new problems to solve. And I had to be out there along with my teams, watching, learning, understanding their barriers in order for me to figure out what I needed to do to guide them or help them to resolve those issues. When it comes to process improvement activities or quality initiatives, everything that we were doing and getting really good results with from quality perspective changed the minute that we introduced COVID. The very things that we were doing to keep our patients safe from hospital-acquired infections, for example, or pressure injuries, for an example, everything that we were doing stopped working in that population of patients. And so we had no time to research it and do a data review retrospectively and just wait for someone else to publish a best practice. We had to get in there and figure it out in the moment. And I think that that forever will change the way that we approach the need to improve our processes and improve quality.
And I'll keep it short and sweet, but I do think a silver lining was dispelling the notion of the silos, and we really just all came together. It didn't matter what, you couldn't see a badge, right? You were completely covered. So it didn't matter your role. Everyone was there for the same reason, to help one another.
Yeah, I love that. And I think as someone who runs a company who is helping with PPE, I was so impressed with hospitals' response to the pandemic and trying to protect those on the front lines. I know I was talking to senior leaders at every hospital institution at 5 a.m. and still again at 2 a.m. And Jody, to your point, all of you, your entire teams, your staff, no one took a day off. And I think it's something that we all kind of took for granted elsewhere, but the burnout is real because everyone's been working nonstop trying to save lives. And when you think about taking a day off, your thought, well, not putting words in your mouth, but what you all aren't saying is, if you took a day off, that could have led to someone dying or being in an unfair situation. And that is something we're all very, very grateful of. So thank you all, and thank your teams as well. A different question that's just come in from the audience. Have you seen hospitals rethinking the discharge protocol of homeless patients or others who are unable to pay for their care?
I'm happy to jump in.
Yeah.
I think that, yeah, absolutely. But I don't think that necessarily is related to the pandemic at all. I think that in general, and it goes back to the question that you asked earlier around, are we putting two initiatives at odds, consumerism and our need to take care of those who might need us most. The discharge in hospitalization might very well be the most dangerous aspect of the entire hospital stay. How do we wrap up their experience in a way that when it comes to the discharge, that we're doing it in a safe way, that they're educated, that they understand the follow-up needed, all of those things. And again, we know that we can do better. It's very, very difficult to, what we're finding, at least, and I'd love to hear from my colleagues here, but what we are finding, at least in our environment, when we take care of a very large population of underinsured and uninsured, is that sometimes they just don't have any place to go. And so a patient that maybe came in for a pretty run-of-the-mill admission that normally a patient with insurance or a home would go home in 3 or 4 days, they can actually end up in our hospital stuck for 100, 200, 300 days It seems hard to believe, but it's true. And I think that what it speaks to is our need to partner with groups outside our four walls of the hospital. Because when it comes to that safe discharge and caring for our community, there's only so much that we can do, and we need to have a safe handoff. And what happens when you don't do that is now that bed is being taken up by a patient who really doesn't have a medical issue anymore, but we can't give it to a patient who does have a medical issue. And so lots of challenges in that realm, but definitely partnership with the community is something we need to work on more and more.
Definitely. So one last question is, how are you finding that patients are making decisions between institutions? What are they looking for? Besides, obviously, the correct answer is institutions with Care+Wear products, but besides that. Nicole, what are people, why are people
Yeah, I would
choosing
say
North
it's
Shore?
ease of access and ease of care. That's realistic for them. So when you talk about the discharge process, like, is this something that's truly attainable for your patient and their family? That goes back to what we started with around trust. And if we have this unrealistic expectation, then we're not truly caring for our patient and family. So I would say they're really looking for a trusting environment with exquisite communication.
Yeah, I think that's totally true. I think we can't forget about the financial toxicity piece either, though, and more transparency about that, which I do think is coming, is going to be really critically important, because just the numbers are terrifying to see, what type of debt patients are incurring for different diseases and illnesses that they have. So hoping that type of transparency will happen in the future.
Jody, last but not least.
You took the words out of my mouth. That financial toxicity is so complicated. I think I've used that word about 100 times in this panel, but it is so incredibly complicated, and it is not straightforward whatsoever. And patients want it to be straightforward, especially now with their high deductible plans. If they're going to be spending $10,000 out of pocket before any insurance benefit starts to kick in, they want to make sure that they are getting as much with those dollars as they can. And so the more that we can do in partnership with really leveling the playing field and making sure that patients understand what it is that they're getting for their healthcare dollars spend, will go a long way to ensuring trust.
Absolutely. Well, unfortunately, that's all the time we have for now. I feel like this is a topic that we could talk forever on. And to our panelists, thank you so much for being a part of today's discussion. It's been such an honor and privilege to get to speak with you three. And to our audience, we hope this was not only informative, but leaves you thinking about healthcare differently. The care that you receive, the care you deliver, and the systemic experiences of healthcare. I hope you'll join me every day in clapping your hands at 7 p.m. For the amazing staff out there. Our goal with these discussions is to bring together the amazing minds within Care+Wear's network to foster innovation within the healthcare space. We'd love to hear from you and hear what you thought of these. Please feel free to reach out to us at press@careandwear.com with any additional questions. This discussion will also be available online later today on YouTube, and you'll receive this link via email in the coming days. For all the latest things on Care+Wear, you can also follow us on all social media, Facebook or Meta, whatever they're calling it these days, Instagram, Twitter, LinkedIn, TikTok, and more, all at Care+Wear. Thank you again. I hope you all have a wonderful day, and hopefully see you soon. Take care.
Bye-bye. Happy holidays.
Be well.